Good afternoon, everyone. So glad you could join us. My name is Joe Schrader, and I am with the OSSA staff. And on behalf of all of us at OSSA and WCAS, want to extend a very warm welcome and thank you for joining us in this webinar. Our focus for today is helping both students and staff cope with crisis and loss during the COVID-19 pandemic. During the session, besides providing practical advice on how to help students and staff cope, we'll also be reviewing the unique challenges that schools face in supporting grieving students during a pandemic and highlighting free resources that you can access to address these issues. Regarding our session, we are scheduled for up to 90 minutes, up till 2:30. The first half will essentially be a presentation around content from our expert, Dr. David Schoenfeld, and then followed by Q&A from, again, the things that you will bring to us through the chat line. In terms of some logistics for today, we had over 200 people, leaders, pre-register for this session. I know many people, because of all the things going on now, are going to be watching the recording as well, but also we expect more to continue to join us as we get underway. So thank you for understanding with that. We've already automatically muted your connection. I see that most of you, if not all of you, have already also turned off your camera, which will just help with this many people that we expect in making sure our bandwidth is really strong and the connection is great throughout the session for everyone. Please know, as I mentioned in the chat line, we are recording the session in full. Dr. Schoenfeld will also be sharing graciously a PDF of all his slides for today. We expect to get both the recorded link and the slides to everyone's email inboxes. That means anyone who registered for this in your email inboxes by sometime on Monday. Also, please know that I'll be monitoring the chat line as we go. So at any point from this point forward, just get your questions in there. Again, the second half will be devoted to trying to get answers to all the questions we can in the allotted time. So let me then please introduce our guest today. Dr. David Schoenfeld is a developmental behavioral pediatrician and professor of clinical pediatrics at the Keck School of Medicine of the University of Southern California and the Children's Hospital of Los Angeles. He is a member of both the Executive Committee of the American Academy of Pediatrics Council on Children and Disasters and the National Biodefense Science Board. He has previously served as a commissioner for both the National Commission on Children and Disasters and the Sandy Hook Advisory Commission in Connecticut. Dr. Schoenfeld was also president of the Society for Developmental and Behavioral Pediatrics and a winner of the 2019 Simms-Mann Institute Whole Child Award for Medicine. Dr. Schoenfeld has authored over 150 scholarly articles, book chapters, and books. He has provided consultation and training on school crisis and pediatric bereavement for over 30 years in the aftermath of numerous school crisis events and disasters, including 9/11 within the United States and abroad. He has also conducted school-based research through partnership with a number of foundations and organizations involving children's understanding of and adjustment to serious illness and death, and school-based interventions to promote adjustment and risk prevention. So needless to say, after all that we are very blessed to have, if not certainly a leading expert, but probably the leading expert on this topic in our country and beyond. So thanks so much, Dr. Schoenfeld, for joining us, and I'll turn it over to you.
Thank you, and thanks for inviting me to talk with you today. So what I'm going to be talking about is, I'm going to start by giving you a brief introduction of the National Center for School Crisis and Bereavement, mainly so that you know that this is a free resource that's available to provide support and assistance to schools and districts throughout the country. And then that'll probably take about 5 minutes or so. And then I'm going to turn to really the topic at hand about how to support children around crisis and loss during this pandemic. And I'm going to begin by sharing with you some information about why we should be prioritizing this through Tier 1 or universal supports for students, and then turn to some practical advice about how do we help children cope with the current pandemic. I'll then talk some about supporting grieving students during the pandemic, and then touch on the topic of staff support and professional self-care, and then we'll have some time for questions and discussions. So let me start first with introducing you to the National Center for School Crisis and Bereavement so that you're aware of the resources. I do want to acknowledge that our core funding for the center is now provided by the New York Life Foundation. And the center was created back in 2005 to promote an appreciation of the role that schools can serve to support students, staff, and families at times of both crisis and loss, to enhance training of individuals in the areas of crisis and loss, and to serve as a resource for information, training materials, consultation, and technical assistance. And I do want to say that the technical assistance is actually provided at no cost to the school, thanks to the support that we have. So that's why in particular, I want to make sure you're aware of that resource. So some of the services that we do provide are we have an interdisciplinary team of medical, mental health, and school professionals. And through that, we provide confidential, either on-site or remote technical assistance and consultation, which is really geared to school leadership and school professionals. We provide practical and timely advice. We have a 24/7 toll-free number and informational email address, and I will share all that contact information on the last slide. And then we also do provide ongoing support. So we don't just respond to the immediate aftermath of a crisis, but we provide support throughout the long-term recovery period, which sometimes lasts multiple years. Some school districts we work with for over 5 to 10 years. We also have some free educational resources and crisis management tools, and we do provide staff training and community presentations and professional development. I thought it might be useful just to share with you some of the communities that we have supported. I've done this work for over 30 years now, so it really is a long list. We get about 2 consults per week, and so that adds up. But this will just I'll just share with you some of the ones you probably are most familiar with. As was mentioned, we coordinated the training for the school crisis teams after the World Trade Center attack in 2001. We've also worked very closely with Broward County Public Schools after the school shooting in Parkland, Florida, going out there monthly since the shootings have happened. We also coordinated the initial response for the first week for the school shooting at Sandy Hook Elementary School. We've been providing support for the school shooting in Santa Clarita, California at Saugus High School, the community shooting in Las Vegas, Nevada, the school shooting in Benton, Kentucky, the shooting at the Borderline Bar and Grill in Thousand Oaks, California. We worked with Floresville, Texas, the school system that had the most students that were impacted by the Baptist church shooting in Sutherland Springs, Texas. We worked with Spokane, Washington after their school shooting, Marysville, Washington, Corning, California. We did a lot of work with Aurora, Colorado after the shooting that occurred in the movie theater there, as well as the school shooting in Platte Canyon, Colorado, Chardon, Ohio, and Townsville, South Carolina, just to name some of them. We also do support after natural disasters, and so that would include Hurricane Maria in San Juan, Sandy in New York and New Jersey, Katrina in New Orleans, and Ike in Galveston, Texas. We also provided support in Joplin, Missouri after their tornado, as well as the tornado destruction in Alabama. And a lot of work around wildfires, including Sonoma County, California, Sevier County, Tennessee, as well as most recently Butte County, California. So that just gives you some of a sense of other communities where we've provided on-site technical assistance and support. We also do some work internationally, including providing on-site support to Akita Elementary School after the stabbing in Osaka, Japan, and the earthquake in Sichuan province in China in 2008 that killed, I think it was about 69,000 people, including a number of school children. A lot of the work internationally, though, has been through academic presentations, and these are just some of the countries where I've gone and done presentations. So I'm just giving you that as a way of background so that you understand a little bit more about the scope of some of the impact of the center. But let me turn now to talk about the real topic that we came here to talk about today. And the approach that I'm going to recommend for providing students support in the aftermath or during actually the response and recovery for the pandemic is really using the multi-tiered system of supports, with most of the services being delivered through universal or tier 1 services. And I know you are well aware as school administrators that that's generally what you should do, but I think it's particularly the case in this pandemic. And so to illustrate the validity of the approach, I want to share with you some of the findings of the mental health needs of students in New York City public schools in the aftermath of the World Trade Center attacks. So please recognize that there was about 6 months delay between the World Trade Center attack and when this study was done. So we're about 6 months, when schools reopen, I should say, in late August or September, you're going to be about 6 months out after the pandemic really started in our country. So the time frame is similar. But I also will point out that not only did we see the response from the World Trade Center attack in the study I'm going to refer to, but there were also ongoing threats of terrorism in the country, and that included anthrax scares, which affected the New York City area. So there were concerns that children and adults had of being infected through anthrax. And so you're going to find that this probably, in my opinion, is probably one of the few studies that has relevant data that can show us what we should be expecting to see around the time schools reopen. So this needs assessment was actually conducted, as I said, 6 months after September 11, 2001. And it was conducted by Applied Research and Consulting, Columbia University Mailman School of Public Health, and the New York State Psychiatric Institute. So they surveyed a representative sample of over 8,000 students in grades 4 through 12 attending New York City public schools. And the student compliance rate was actually very high for the study. It was approximately 92%. They were able to use passive consent at the older grade levels, and there was high buy-in. So it's a very representative sample. Among other variables, they surveyed children's self-reports of their current mental health problems, but they also looked at self-reported impairment in daily functioning. So children were felt to have a probable psychiatric disorder only if they reported all the symptoms consistent with diagnostic criteria for that disorder, but also reported some impairment in functioning. So this could really be seen as kind of a conservative estimate of the prevalence of mental health problems after the World Trade Center attack. Despite that, I'm going to just preface this by saying the results are very disturbing and show very high rates of impact. So this slide outlines some of the key findings just related to the prevalence of probable psychiatric disorders, again, persisting 6 months after the event. 1 out of every 4 children, or 27%, met criteria for 1 or more of the probable psychiatric disorders that were assessed in the study. Rates of post-traumatic stress disorder, or PTSD, depression, agoraphobia, or the fear of open spaces, and separation anxiety were 2 or more times higher than rates in other US communities that were surveyed prior to 9/11 and used as a comparison. Approximately 1 out of 10 of the students had PTSD, major depressive disorder, separation anxiety disorder, and panic attacks. And 15% had agoraphobia, or the fear of going out or taking public transportation. Now, this concern about agoraphobia is something I want to focus on, and this was actually compared to 5% baseline rate in a comparable community. So that was a 3-fold increase. And as I said, some of this I think had to do with the ongoing concerns of terrorism and also specifically related to anthrax scares. Now, we don't know yet what impact this pandemic is going to have on children's mental health. We're getting some preliminary findings which do support some of these results that I'm going to share with you. But I'm gonna say that I am concerned we're going to see an increase in children's fears of leaving their home and re-entering public spaces such as schools. And that relates to some of that agoraphobia I talked about. Schools need to be prepared to provide outreach to students who don't return to schools when they open, since many of these students are going to be the ones most impacted. And we really should be reaching out to students already if they fail to join virtual classes in the past, or they didn't seem to be participating with their academic work while we were having virtual classes, at least to the same degree they were doing prior to the pandemic. Now, beyond the high prevalence of probable psychiatric disorder, what was also shown, which relates even more to why I'm talking about Tier 1 services, was that adjustment problems, even 6 months after 9/11, were nearly universal. 87% of the students reported at least one PTSD symptom persisting 6 months later. 76 reported often thinking about the World Trade Center attacks, and 45% reported trying to avoid thinking, hearing, or talking about it. 25% found it harder to keep their mind on things, so they were still having trouble concentrating, 1 out of 4 students 6 months later. 24% were still having problems sleeping. 17% reported nightmares, and 18% reported that they had stopped going to places or doing things that reminded them of 9/11. Now, 11% of the students reported at least 6 of these symptoms, which were referred to as PTSD symptoms. And that was what was felt to be required to be consistent with probable PTSD. Now, I want to note that these adjustment symptoms may actually be seen in other mental health conditions and from bereavement. So, for example, sleep problems, nightmares, and difficulty concentrating are going to be seen in bereavement, depression, and anxiety disorders. So while they were referred to by the authors as trauma symptoms, I recommend that you actually view them as adjustment problems. Now, at least 2/3 of the children who had what they self-reported as symptoms consistent with probable PTSD and also reported that they had problems with their functioning, also reported that they had not sought any mental health services from mental health providers either within or outside of the school 6 months later. So these findings taken together show us that after a major crisis event, adjustment difficulties are going to be pervasive and they're going to be long lasting. And in most cases, they're not going to receive traditional mental health treatment. And this is despite the fact that free counseling was available at every school throughout the New York City Department of Ed due to substantial federal recovery funding. And unfortunately, I don't think we can expect to get that type of federal recovery funding in schools to deal with the pandemic, particularly because of how widespread the impact is. And I do recognize already schools are dealing with very reduced budgets, very constrained budgets, and a lot of pressures to try and save costs. At the same time, there are all these incremental expenses that are going up. And I'm really concerned that it's going to be hard just to maintain the support for the very limited and often insufficient mental health services that were in schools prior to the pandemic, even though we're going to need a lot more. So all of this underscores the need to shift from exclusively the medical model. And the medical model is really more characterized by screening, evaluation, diagnosis, and then referral for treatment that you think have a mental illness, for individuals that you feel have a mental illness. And move instead towards a system of universal support as at least the primary response during the pandemic. This would be more focused on providing support and building resiliency. Now, this would have to be coupled with incorporating school mental health professionals to provide additional support and services to children that do require more assistance. That's the Tier 2 services, as well as even those that need more intensive services for those in Tier 3. Although I do anticipate that much of the Tier 3 services may need to be delivered through community mental health providers, simply because of the burden of all the work that's going to need to be done in Tier 1 and Tier 2. Now, having said you have all of these problems, and children in New York City schools were reporting these symptoms, and again, these were representative samples across all 5 boroughs in the city. Despite that, we know from experience, including in New York, that parents and other adults that support children, such as classroom educators, tend to underestimate the extent of children's reactions to a crisis situation, especially when it's related to how they feel. We can do an okay job if we're thoughtful on observing children's behavior, but we really can't observe how they feel. This is one of the posters that was used by Project Liberty about 6 months after 9/11, and they all had the same tagline: if only the signs were this easy to read, because it's not that easy. Children may actually withhold their complaints of their reactions because of concerns that their reactions are abnormal or at least inappropriate. And sometimes they just want to protect their parents and other adults who are visibly upset. Adults, in turn, including educators, often avoid discussion of troubling events in order not to contribute to student distress. And they're often just afraid that they're going to upset children or say or do the wrong thing and just make matters worse. But what I hope I will encourage you is to believe is that saying nothing is precisely the wrong thing to say after a crisis. It communicates to children that adults are either unaware, unconcerned, unable, or perhaps most worrisome, simply unwilling to be of assistance. And those aren't messages we want to deliver to children, particularly at this time. Now, one approach for providing this universal support in the immediate aftermath of a crisis is referred to in the field as psychological first aid, or PFA. And this involves offering psychoeducation. So you give information about what you might expect to see in yourself and your colleagues and peers, and also what can you do about it. And it also provides supportive services to foster effective and normative coping strategies and adjustment. The goal is really to accelerate the natural healing process. It's not a treatment intervention. It's not targeted to individuals experiencing distress. It is offered to groups and populations that have experienced a significant crisis event. And you really want all adults working with kids in your school to understand the likely reactions they may have and to know what they can do to help children cope. Because the reality is that anyone that interacts with children and their families can be a potential source of assistance and support after a major crisis, but if they're unprepared, particularly if they appear to be disinterested, it can actually become a further source of distress. And we find that it's really important that you reach out and do this training to everyone in your school. I remember going and talking to one school that had experienced a large community shooting, and I was meeting with the superintendent before the reopening of school. And I looked at him and I said, you know who the first face of this school is going to be? And it's your bus drivers often. And so that superintendent just called and had bus driver training done the next day on how to provide psychological first aid. So how you are greeted by the first person makes a difference, and how you're greeted by everyone in the school makes a difference. And individuals in schools in support functions can provide very needed services. I remember talking to a group of bus drivers on how to support grieving students. And one of the bus drivers said, well, how can I actually do anything? I mean, I just drive the kids to school. And one of the bus drivers just turned to him and said, you know, the other day I dropped off a group of kids at the school and I asked one of the students to stay back and talk with me afterwards. And I looked at him, I said, I heard your brother just died. No kid should ever have to deal with that alone. Will you promise me you'll go into the school and ask to speak to a counselor as soon as you get in? And he said, I'll do that for you. So there are things you can do, and a lot of your support professionals provide support to kids, and they're in a very unique position. So I often tell this story. I was doing some training for the staff at Flight 93 Memorial. Flight 93 was en route to Washington, D.C. on September 11th, 2001, and the passengers became aware that planes had flown into the World Trade Center that were because of terrorism, and they also were aware there were terrorists on their flight who had taken hold of the cockpit. And so they decided, the crew and the passengers decided that they would intentionally down the plane so that it would not cause harm in Washington, D.C. And as a result, the plane crashed outside of Pittsburgh. So the National Park Service has a park there and a visitor center. It's a beautiful park if you have the opportunity to visit when things reopen. And they asked me to do some training for their staff on a couple occasions. And after I had gone over some of the training, and that included psychological first aid, someone came up to me and they said, you know, I actually oversee some of the groundskeepers in this park. And he said, and you know, I have trained them that this is sacred space. I mean, we should be honored that we are here. And if one of the visitors should enter your frame of reference, you know, and you're cutting the grass, you should stop cutting the grass, establish eye contact, and ask if you can be of assistance. And he said, you know, we're not here for the grass, we're here for the visitor experience. Now, if you can have the National Park Service train the people that cut their lawn, that they have this higher mission, you should be able to do this for anyone who works on their school campuses. Because anyone who works on that campus, irrespective of their role, should recognize that they're there for the student experience, and you want them prepared to be able to help kids when they've been through a crisis event. Now let me turn to some practical advice just really on how to talk to and support children during this particular pandemic. So the first thing is, don't pretend that everything is okay when it obviously isn't. Children can pick up when adults are not being genuine and honest, and if they pick that up, they're not going to ask questions or seek advice. Children also benefit from knowing that important adults in their lives, such as parents and educators, also have concerns and learning in particular, how do those adults deal effectively with troubling or distressing feelings? We can't expect children to share their concerns when we're unwilling to even share that we have concerns ourselves. And we certainly can't help them learn how to cope effectively with distress if we don't model and share effective coping techniques. But this does not mean that adults should share all of their concerns. Children may pick up on concerns that are primarily those of adults, such as related to how the pandemic may impact employment or income of parents and other members of the extended family. And parents should try to discuss these concerns privately. But if children do pick up on that, it is important to have discussion with them. What you want to do is to provide appropriate reassurance, but you don't want to give false reassurance or attempt to minimize their concerns. Instead, we should find out the individual child's fears, concerns, or skepticism before we try and reassure them. Children often have very different concerns than adults do, and some of these are based on misunderstandings and misinformation that we can correct. But often, they're just their own concerns, and they're quite legitimate. And you really can't reassure people if you don't know what they're actually afraid of or concerned about. Otherwise, you probably really aren't offering reassurance. You're just telling people why you aren't scared or why you aren't worried. And when two people each talk only from their own perspective, we call that arguing. And arguing doesn't provide effective reassurance. We also shouldn't tell children that they shouldn't be worried. Instead, help them learn to deal with their uncertainty and fear and share with them strategies to deal with distressing feelings rather than pretend that they don't or shouldn't exist. Be sure to include positive or reassuring information and present overall a hopeful perspective. This is actually not a good time to convey to children your personal strong criticism of the government's response to date or your candid assessment of the leadership of those in public office, unless the children are specifically seeking your advice on how they should vote in the upcoming election. So try instead to convey that overall you hope and expect that scientists and public health officials are learning how best to handle the situation, and that you anticipate your community, your country, your state is going to be making the appropriate decisions to address the pandemic. Then begin to explore with children different strategies of dealing with distress, discomfort, anxiety, and sadness, some of which are included on this slide. This might include reading or hobbies to promote healthy distraction. I just want to clarify, when I say healthy distraction, that's to distinguish it from unhealthy distraction techniques such as alcohol and drug use. Those do increase after crisis events and major disasters, and you should be sure that your school has strategies in place for identifying and managing substance use among students and staff. I will say, just as an aside, that I actively discourage the use of alcohol among adults during recovery phases from crisis events. And I was going over this in one of the school districts that I was talking with. The superintendent told me that maybe they made a mistake because actually they shipped wine to the homes of their staff when they first were sheltered in place. And I said, you really don't want to be providing alcohol to people when they're under a great deal of stress. So when I talk about healthy distraction, it's, reading and hobbies and those type of things. You also can use talking to others, journaling, blogging, art and music, and other means to promote expression of feelings. And you really need to do both. You have times when it's healthy to distract yourself so that you can become relaxed and try and rejuvenate yourself to a degree. But then there have to be other times where you face and process what's worrying you. The problem is that if you're sheltering at home, let's say 2 adults, one may want to distance themselves while the other one wants to talk about it. You can see how that will cause conflict. So you just have to recognize both are appropriate, but unfortunately, people often aren't in sync as to when they would like to do it. Exercise or yoga can also be used for self-calming, appropriate use of respectful humor, and relaxation techniques and mindfulness. And those can be taught even to very young children. There are some strategies that can be also taught to children, but that would require some involvement of people with the expertise in those particular areas. So for example, self-hypnosis and guided imagery can be learned to deal with anxiety, and cognitive behavioral therapy and approaches can help children replace some of their negative thoughts with more positive interpretations that ultimately results in changes in their feelings and their behaviors. Now, many of these techniques can and should ideally be learned before children are experiencing high levels of distress or anxiety, because many, particularly the ones that are more clinically oriented, involve practice and coaching, and like any other skill, they're easier to master when you're not under a great deal of stress. But actually, the principles of all of these can be introduced in basic skills learned even now during the pandemic. We also should help children identify developmentally appropriate steps they can take personally to protect their own health and to help others. Because to be honest, you're not going to be able to make sure children do everything they're supposed to do related to hand washing, physical distancing, and mask wearing unless they take responsibility for doing it themselves. For younger children, you want them to learn from early on in the pandemic, hopefully already, but let them how to wash their hands. But they should be able to pick out the soap that they prefer to use if you have options, and let them provide input into their own hand washing technique and routine, such as picking out what song they'd like to sing. I'm not trying to be critical, and I don't know who even made this recommendation, but to be quite honest, if you had to quarantine during the time period when it was your birthday, and you couldn't have a birthday party or celebrate that day with your friends or family, probably the last thing you want to sing every time you wash your hands is happy birthday. So let's let kids pick out what they'd like to sing. We can also identify ways for older children so that they can safely help others, such as dropping off food outside the door of elderly neighbors or making regular phone calls to speak with grandparents who are otherwise isolated. In general, finding ways to help others can help children and adults feel some sense of agency during a time when many of us are just feeling powerless. Now, although you do need to do universal support, that isn't going to be enough for all children, obviously. And some children may need further support beyond what's offered to all students. The pandemic and discussion about the impact on families may remind children and adults of other difficulties in their lives, whether that be events in the past, ongoing challenges, or concerns they have about future crisis or loss. And these children may also find this time to be particularly difficult. So children, for example, that are already having difficulties around racial discrimination, some of the media attention around the protests may bring this to the forefront for them. Children who also already had a parent who was ill from, say, cancer or some other problem may become more worried now about the well-being of their relative or friend. Children who were anxious or depressed before the pandemic will likely need even more support. So we should be encouraging families to reach out to their mental health and pediatric healthcare providers, at least by phone and email, to get some additional advice and support. We should recognize that when children are highly stressed, they may regress socially. They may act less mature, become more demanding or selfish, or just have more difficulty getting along with peers and family members. Some children may just say they don't want to talk about it and appear disinterested because they are overwhelmed with their own concerns. Those children may need to focus first on their own needs. What does this mean for their college plans, their vacation, their sports or hobbies, their friendships? They may need to focus on all of that first before they're able to start to think about the needs of others. This is often a sign not that they don't care about other people or that they're not aware how serious it is, but rather that they're under a great deal of stress and having difficulty coping. And we really have to tell adults and peers, trying not to make kids feel guilty for thinking about and sharing their personal distress and how they feel the crisis is impacting them, even if the impact is far less than it is on others. You can imagine a student complaining about the fact that they can't resume their soccer team practices, or they can't get their yearbook signed, or they weren't able to celebrate their birthday, and talking about how it's unfair and just, they are so impacted. And have a parent just get frustrated and say, well, you know what? There's some kids who got very sick or had parents or family members die. You should be grateful you're not part of that group. You should feel lucky. Now, the problem with that is it doesn't actually make kids feel better about missing their birthday party. All it does is make them feel guilty that they're bothered by that. And it makes it much less likely that they're going to want to talk to these same adults. And they do have additional concerns. So you might ask, well, why would adults do that? Adults do that because they are impacted at least as much by the pandemic, and they often demonstrate the same type of regressive behavior and act similarly. While crisis response can bring out the best in people, to be honest, it generally brings out their stress. And so we likely all won't be at our best all the time, at least. And being around people who are needy, demanding, self-centered, or distressed isn't fun or particularly satisfying when you're a school administrator, but it is your reality. So try to be patient with students, their families, the staff, and your colleagues. And above all, you need to be patient with yourself. Now, during this time, we all should be watching our media consumption. Make sure it's a healthy diet and make sure we don't consume too much. Adults should try to keep informed through focused but periodic attention to a trusted media outlet or other source of information. Don't listen to, watch, or read continual coverage, even though I'm quite aware it's available. This pandemic's going to be here for quite some time, and you're going to just get overwhelmed and exhausted if you try and keep up with all the information. Remind yourself there are actually two main reasons to listen to, watch, or read media coverage during a crisis. One is to be reassured, and the other is to learn new practical steps to keep yourself or those you care about safe. If you are watching or listening to media and you aren't feeling reassured and you aren't learning new practical information about actions you need to take, then it's time to disconnect from the media, whether that's television, radio, print, and social media, at least for a period of time. You should be advising children to also limit their amount of media exposure, but we also have to tell adults of this as well. This is actually a good time for everyone to just unplug and connect instead with family and friends, whether in person or remotely. It'll allow parents to focus their attention on children's needs and provide and receive support. Now, this pandemic is also causing a large and expanding number of deaths, while also requiring the implementation of physical distancing measures, including lengthy school closures, and it makes it increasingly difficult to provide bereavement support to grieving students in the usual ways we relied upon prior to the pandemic. So what I want to do at this point is just outline some of the unique characteristics of grief during a pandemic, and also let you know about free resources that are available through the Coalition to Support Grieving Students website for addressing these challenges. And I'm going to tell you how you can get a document that really just summarizes these challenges and offers direct links to the most relevant resources. So I'll go through quickly, and you don't have to try and write down the resources. After the death of someone close, even when there's not a pandemic, children often become more concerned about their health and that of others they care about. But in the setting of a pandemic, there's already often extreme concerns about personal health and that of others. So the ability to reassure children that others close to them are actually healthy and not at risk of dying becomes particularly challenging right now, even if the initial death was unrelated to the pandemic or even unrelated to an infectious disease. So it becomes important to help children deal with their fears and concerns about the pandemic, in addition to any grief they may be experiencing after a personal loss. And we actually have free materials on our website now and present that include written materials and taped presentations for educators, parents, and school professionals on how to talk to and support children regarding the pandemic. And I'll share with you how you can get to those resources. As already mentioned, physical distancing measures are in place, including lengthy school closures, and that will increase the social isolation that's generally experienced by children who are grieving, but it also makes it difficult for schools to provide support using traditional means. And this really, of course, this is certainly true, but it's also true that schools do provide meaningful support to grieving students when deaths occur during summer vacation and holiday breaks, using phone, email, and the internet. And those same strategies can be used during the pandemic, and they are actually outlined in the coalition materials. We also need to recognize that secondary losses during the pandemic become even more of an issue. After the death of a close family member or a friend, children need to not only cope with the loss of the person that died. In the field, we call that the primary loss, but they also have to deal with the loss of everything that person did or could have done for them. And that's the secondary loss. So there are a lot of secondary losses that occur whenever a death occurs of someone close to you. But during a pandemic that requires physical distancing and school closures, the magnitude and importance of these secondary losses may actually be accentuated. Families may be finding acute challenges to meeting basic needs, such as obtaining food, health services, or supervision for young children. And the usual outpouring of assistance, support, and companionship that would normally be provided by extended family, friends, neighbors, and members of the school community, at least in the immediate aftermath of a death, may simply not occur. And funerals may need to be postponed and family and friends unable to visit. And so the role of school and school professionals in helping to provide those services or helping people find access to those services becomes particularly critical during this pandemic. Family members may also be overwhelmed by the pandemic in addition to their own grief. So surviving parents, and when I say parents, I mean really any adult in the home that provides supervision to children, surviving parents not only have to deal with their own grief, but they have to deal with the impact of the pandemic, worries about their own health and how to care for elderly parents, for example, financial stresses, practical concerns about obtaining food and services. They have to do all of this while dealing with their own grief and caring for grieving children. Extended family and friends are likely to be preoccupied with the pandemic themselves and meeting the needs of their own family. And so they may not only not be able to come over, but they may not even have the energy or the time to reach out and provide remote support. And again, a lot of this then falls on school professionals and healthcare professionals to help meet this important need. And meeting basic needs is the first component of mental health services in the aftermath of a crisis. Another challenge during the pandemic is that children may experience more than one personal loss, and deaths of students and staff may impact the entire school community more so than prior to the pandemic. As the number of deaths increase in the country, children may experience more than one loss, and these deaths do tend to cluster due to the spread of the virus. And that's been occurring already in many cities throughout the country. In New York City, for example, I spoke with one school where they already had experienced over 100 deaths of members of their school community just attending that one school, many of those being family members of students and staff. And the grief children experience from these multiple losses is referred to as cumulative loss, and we do have a resource on the Coalition page about that. The death of a member of the school community, though, can also have a more profound effect during the pandemic. So generally, if a student has a grandparent who died, that may not even be known by most of the people in the school. But if the community is dealing with the pandemic and worried about the health of elderly as well as younger people as well, they may very well become informed of that and feel very vulnerable as a result of it. So we have a section in the Coalition that deals with death in school crisis, and that offers some of those unique considerations when you have death that impacts large groups of people. And then some children's grief may not actually be related to a loss that's due to death itself. For some children who don't experience the death of someone they know, they still have to cope with separation from loved ones, whether it's hospitalization, quarantine, travel restrictions, or just inability to visit older relatives or their friends. But they may also grieve their inability to celebrate their graduation, the birthday, or a special occasion, or just grieve the loss of a sense of safety. And the website for the Coalition has guidance on that. We call it in the field ambiguous loss. Transitions such as from high school to college may be particularly challenging as well during the pandemic, and we have material on how to assist grieving children with these transitions. Grieving students often experience at least temporary academic difficulties, and quite honestly, so do all children during a crisis. So as schools transitioned rapidly to online learning during an evolving pandemic, many kids just found it hard to focus and experienced academic challenges, and many educators were uncomfortable with abrupt shifts to remote and distance engagement approaches, changing expectations for instruction, and their lost connections with students and colleagues. And we have modules on the impact on learning, which talks about appropriate academic accommodations. And we also do talk about grief triggers, which offers important insights and recommendations that are going to be relevant to all students during this pandemic, whether or not they're grieving a death. And lastly, we just have to acknowledge that supporting grieving students can be difficult in the best of times, and this clearly is not the best of times. So it's a really difficult time, but a critical time to maintain your professional self-care. The impact of the pandemic is going to be a lot longer than I think most people are even prepared to accept at this point. And now is the time to invest in professional self-care. And we have some materials on the website that deal with professional self-care. So I just wanted to touch on that as the last topic before I just share some resources and open it to questions. We should really appreciate what impact all of this is having on us as adults and as leaders. School professionals are going to have concerns about their own health or those of family and friends, and please do what you can to address these needs. Don't just focus on the needs of your students and your school staff. Professionals are most likely to feel overwhelmed when we feel unable or unprepared to provide assistance. But let's remember there's a lot we can do even in the midst of an evolving pandemic. While we can acknowledge the limitations in our current knowledge and our resources, we shouldn't minimize the value of our guidance and the assistance we can and do provide. Just because you don't know everything doesn't mean you know nothing of value. You all know strategies that have helped in the past to decrease student and staff's distress, and you should try some of them now. You may not feel that what you can offer, especially remotely, is enough. And individual children may want and may need more than you can provide at times. And when that occurs, reach out to colleagues and resources in the school district and community when you feel more is critically needed. But all of us should try to recognize and celebrate the positive contributions we can and do make. The moments you're able to help a child smile, even if it's only for a moment, or help them learn something so that they felt a sense of accomplishment during a time when they would otherwise just feel overwhelmed. When I work with healthcare providers in the aftermath of really devastating disasters, they tell me typically that they feel helpless and wonder if they're making any positive impact. And I suggest that they periodically huddle as a team, not just to identify ongoing problems, but also to share and celebrate small successes. We also have to try and set reasonable expectations and communicate these to children, parents, and educators. And I think this is a particularly important message to come from superintendents and other school leaders. Children are simply not going to learn as much schoolwork during this time period as they would have had we not had to close schools and if we weren't in the middle of a crisis. So don't try and keep the same pace of learning, or this is just going to overwhelm students and educators, and then their time together is going to be more of a source of distress than a source of support. And I'm going to warn you now that even when schools do resume and they're completely open and there's no need for physical distancing, let's say the virus has been contained, you're still not going to be able to catch up and teach everything that you missed. When schools reopen, the pandemic is likely to still be ongoing and staff and students will still be distressed. In addition, even if you got students' pace of learning back up to what it was before, and teachers' instructional abilities were also back to their baseline levels, that's not going to be sufficient for them to teach twice as fast to make up for any lost progress. We have to recognize and accept at some level the curriculum has simply changed. If we're teaching children how to cope with distress and adjust to this crisis, we're helping them learn life skills that are going to make them more resilient in the future and more capable of dealing with future adversity in their lives. And in the end, to be honest, these are the lessons that are going to be most important. But this comes at a price, and that's what I just wanted to end with. Exposure to trauma and suffering of others can contribute to what's been called in the field vicarious traumatization, compassion fatigue, and burnout. And to protect from this, providers have to have realistic objectives of the purpose of their interactions. For example, if you're working with people who are grieving or trying to cope with a crisis, the goal is not to make them happy or take away their distress, but rather to help them begin to learn how to cope with it. And you have to realize that's what you're trying to do. You also have to have the skills and resources to provide meaningful assistance. You have to be allowed and empowered to provide that support. And then you have to be aware of and have sufficient support to deal with the personal impact of this work on you. The reality is you can't get compassion fatigue if you don't care about your students, but you shouldn't be in education if you don't care. The problem isn't caring about the students. Compassionate approaches can actually be gratifying and bring meaning to the work that you do. The problem is when providers are not supported by their work environment and also don't take care of themselves. So while delivering compassionate care requires concerted effort in any context, it is especially difficult in the context of this pandemic. So I wanted to just turn to some of the organizational mechanisms to support school staff in the aftermath of a crisis. First off, you can provide substitute teachers and additional support staff. In some situations, pairing teachers who are more heavily impacted with others who are less directly impacted. Sometimes you need to use student teachers or even volunteers. I realize we don't want a lot of unnecessary adults in buildings when we reopen because of infection control. But for example, maybe the teachers shouldn't be monitoring movement of the students in hallways or to make sure that they're sitting in the right place in the cafeteria or on the playground. We may be able to use volunteers or other adults to do that, so teachers have some time to take care of themselves and to decompress so that they're not always monitoring students in high stress situations. You may need to modify the workload, the expectations, and the schedule. And I also suggest that you emphasize that teacher evaluations and then their income will not be negatively impacted by academic difficulties of students. That's a burden we shouldn't be placing on teachers in this context. You can also use supportive supervision. This would be especially for your clinical professionals. Social workers, psychologists, and counselors may find their workload very different than it was in the past and really benefit from having someone they can talk with who can provide them some insight into balancing all of these requirements. You want to make sure you have more professional development and also make sure you have a well-functioning employee assistance program or other service to provide support to your staff. You can also think about family and peer support for your adults in the system. We've found that when we respond to crisis events, we make an effort to include spouses and significant others so that they know how to be of assistance. And you probably will want to bring your staff together virtually for social reasons during the recovery period, including during the summer, so that they know they are still part of a group that cares and that will support them. And all of this, again, underscores the need for professional self-care. But there are actually many challenges to this, and I just wanted to mention a couple and then turn to the ones that are unique to leaders. First is making time when there's so much to do and everyone seems to need your help. And I tell people, I've often lost time, but I've actually never found time anywhere. You actually have to make time rather than wait to find it. You may also have as a barrier feeling shame or guilt for attending to your own needs ahead of those of others. And you have to recognize it isn't about putting your personal needs ahead of others, but rather attending to your needs so you actually have the capacity to continue to help others. Often we assume that others are having less trouble adjusting than we are. And as already noted, children often appear less in distress than they actually are, and the same is true for adults, as I mentioned. But the reality is those in professional positions are even better at hiding their distress. Those in leadership positions in schools have raised this to an art form. And I want to say quite honestly, it's not a superpower. Your ability to hide your distress from others just means that people don't know that they should help you. And that's not always a good thing. So a lack of modeling of professional self-care by those around you is the last barrier I wanted to mention on this slide. So practicing self-care and sharing what you're doing to care for yourself may actually help your colleagues do the same. And the last slide is, that goes over issues I wanted to bring up is that there are particular challenges for those in leadership positions. The reality is no matter what you do or how well you do it, you're not going to be able to make everything okay during this pandemic. So try not to judge whether you're effective by whether or not people seem unhappy. They're going to be unhappy. And those impacted by a crisis often react to feeling out of control by trying to exert more control when they feel they can. And I had been, when I was doing presentations back in March and April, I warned people this would be an issue once we move past the very acute phase of the response and start to talk about reopening schools and begin the recovery process. People I predicted would have very different views about what should be done, and they feel passionately about those views, and they will convey them to you individually, in groups such as unions, and through social and public media. And they will be very targeted. And often the concern we see the most is around safety. And you'll have questions about when is it safe for kids to return to school and your adult staff? And what steps are you taking as leadership to eliminate all risk? And obviously, you can't eliminate all risk. You can only try and lower that risk. And where that bar is set is not going to be agreed upon by people. And they will feel very strongly and try and exert their control on it. But there are also the other ones that I listed here are other things that we see after crisis events, conflict around the timeline for returning to a primary academic focus, issues around commemoration memorialization, which is going to be down the line, but not yet. And then the use of donated funds or grants or constrained budget dollars. There will be a lot of disagreement about this. And I will also point out that the reactions that I mentioned can happen in children and adults will challenge working relationship even among your cabinet and leadership teams. You will see this among mental health professionals that do crisis work themselves. They also are short-tempered and often feel very emphatically about things. And then the last reality is you can't stop and focus on recovery. Everything you had to do beforehand, you still have to do. The pre-existing needs didn't go away, and actually they usually get much greater. So same issue around food insecurity, safety of students from abuse and neglect, all of these issues that you had before, you still have, and you still have to teach them and educate them. Now, if I haven't depressed you completely, I do want to say that I've had the opportunity to collaborate with numerous schools and districts throughout the country and abroad. I mentioned the earthquake in Sichuan province in China. It killed 69,000 people in one day, including many school children. I went to schools where, roughly nearly a half of the students died when the school building collapsed on them. And so I've been working also with communities after mass shootings, whether those are in schools or in communities. And in many of these situations, I've seen the magnitude of the crisis and all the challenges it's posed to the recovery efforts. But I have become impressed by really the resiliency of schools, school systems, and communities. And I'm confident schools are going to rise to this occasion. But being resilient doesn't mean you don't experience distress. It just means you can cope with it. So this is going to be hard. And while I know it's difficult, I also know the schools are going to meet the enormous needs of their students as they did every day before the pandemic, and they will continue to do when we reopen. And the National Center for School Crisis and Bereavement is committed to partnering with schools throughout the recovery period. Those who want more information about the center and our free resources can go to our website, schoolcrisiscenter.org. You see the salmon-colored banner near the top of the landing page. If you click on that, it will bring you to the COVID-19 Pandemic Response Resources page. And there you'll find guidance documents on supporting grieving students during the pandemic, as well as presentations for school mental health professionals, educators, and parents on talking to and supporting children during the pandemic. We've actually just loaded this week some sample scripts that classroom educators can use for the first day of school. And there are four different scripts, one for elementary, one for middle and high school, and it's either for in-person classes or remote classes. And just guides you through some of the issues that you may wish to discuss with students on the first day back. We also have links to COVID-19 pandemic resource web pages of other school professional organizations. And the last resource I'm just going to bring to your attention is materials from the Coalition to Support Grieving Students. This is a unique collaboration of the leading professional organizations representing classroom educators. Founding members include the AFT and the NEA. School administrators, that includes, for example, the American Federation of School Administrators, the School Superintendents Association, the National Association for Elementary School Principals, and the National Association for Secondary School Principals. They were all founding members of the coalition, as well as the leading organizations for school counselors, school nurses, school psychologists, and school social workers. And we all came together probably about 6 or 7 years ago with the common conviction that grieving students need the support and care of their school community. This slide lists all the founding members. Since we launched the website about 5 years ago, we've actually added more members. We now actually have 100 members, organizational members in the coalition. And we have a website, grievingstudents.org. And there you'll find video-based and print resources on how to support children who are grieving from a wide range of different topics. And schools can pledge to become grief sensitive and use some of these materials. And those who choose to pledge to be grief sensitive are also eligible for a $500 grant from the New York Life Foundation. There are a lot of free print materials, including this booklet, After a Loved One Dies, which can be freely downloaded in English, Spanish, or Japanese, and we're working on other translations. And they can be downloaded in PDF and shared broadly, Or you can actually order hard copies in English or Spanish, and they're free of charge because of the support from the New York Life Foundation. And they don't even charge for shipping and handling. So you can definitely get some of those as a resource. And the last slide is just the contact information for the National Center so that you know how to reach us. And at this point, I just want to open it up to questions. And I think you're supposed to put them in the chat box, and Joe will help me. So thank you very much for your attention.
Thank you so much, Dr. Schoenfeld, for sharing your expertise and your experiences. Yeah, again, encouraging you to get the your comments in here. And one of the questions that I just want to start with is maybe people think about what they want to continue to ask and explore here with you is you made a distinction at one point early, it seemed to me, when you're talking about your experiences with the World Trade Center, now almost 20 years ago, and the aftermath of that. And as I understood it, I just want to clarify, you were saying like often people describe these impacts on young people and adults alike as traumatic symptoms, and you're saying that you'd maybe characterize it more as adjustment difficulties. Is that go hand in hand with this idea of trying to help get the idea of moving away from just the medical model, expecting medicine or experts to handle it, where all of us can have a hand in this and kind of universal support? Is that the distinction?
Well, part of it is that we have to think about universal support. But the other part is I think there's been some very effective movement in this country and some other countries to try and become better aware of the impact of trauma on children and adults and to become trauma informed. Unfortunately, what I've seen is that that's been such an effective movement that people think everything that's distressing is trauma. And so a lot of times people will just say, oh, well, everything's trauma. You know, like your parents get divorced, that's trauma, you know. And so it's almost as if we use the word trauma to mean distress. But the problem is you do have to become trauma informed. So I'm not saying anything against that. I work with a lot of, individuals in schools where trauma is very important. But you still have to be sensitive to grief and loss. You have to be aware of attachment. You need to be thinking, so there's a tendency to just refer to everything as trauma and just assume you do the same thing. So as one example, a lot of people will say in the mental health field that bereavement is not a mental illness. It's a normal life experience that we all go through. So as a result, it's not as bad as trauma. But that doesn't actually fit with people's life experience. If you have someone who's in an accident and people have been injured and the car was destroyed and they were afraid they might die at the time, often what they'll say was, at least no one died. But then if someone died, to turn to them and say, oh, well, that's just bereavement. That's not trauma. I don't think fits. And so when we talk about adverse childhood experiences, for example, the ones that were studied were things like parental divorce, parental incarceration, but not parental death. But the issue is, I think most people would not be happy if their parents didn't get divorced but died instead. So I think we have to, and the reaction and the treatment is different in the management. So for example, I've had now several schools who won't put pictures of kids who have died in the school yearbook because they don't want to put a trauma trigger in the yearbook. But the issue is you do memorialize, commemorate, and make meaning of the deaths of people. So, I was on the Sandy Hook Advisory Commission, and one of the parents reported that when her child finished the school year who attended Sandy Hook, the yearbook came back and she opened it up and found that the picture of her kid who died at Sandy Hook had been removed, as had all the pictures of all the children and staff who died. And she just said, it's like they think they never existed. What were they thinking? So the issue is, yes, we have to be informed about trauma and use trauma treatment when it's indicated and trauma support. But sometimes it's due to depression, it's due to anxiety, it's due to other issues, social isolation, social ostracism, racial discrimination, and they all can't be handled with the same trauma interventions. So I'm trying to underscore that it's actually, unfortunately, it's more complicated than any one approach. And so I do like to highlight that these reactions can be from a range of different things. And you need to be a little more sophisticated if you're going to try and help people with them.
Yeah, it makes a lot of sense. So on one hand, we all can contribute to a supportive and caring environment. I mean, I thought your example of the Pennsylvania Memorial land where the people who perhaps mow the lawn can be a resource, but they also need a bit of background just how to be a thoughtful and helpful person. I thought, again, another real practical example I mentioned in the chat when you were saying, I can imagine a young child who had a birthday thinking to themselves, happy birthday to me. And that, again, how that doesn't really help me work through this if I'm a young child with that strategy. So appreciate that. One of the things I was also wondering about, you mentioned about the agoraphobia, again, the idea of the fear of moving out of maybe my home into public spaces again, once there's opportunity to do that more and more. I'm curious in your research and your experiences, because that was, as I recall, that was a part of the World Trade Center in New York City, where there's a lot of population density. Wisconsin has some centers like that, but I know many more that are less dense in population. Do you see any difference in terms of setting of population density to the idea of agoraphobia? Again, the fear of coming back into public spaces?
So I think part of it depends on the actual reality of the pandemic. So for example, I have an adult child who lives in New York City, and one of the concerns is taking, the subway. And so there are concerns that those are usually pretty densely packed, and there isn't a lot of air turnover in the middle of the subway. Anybody who's taken the subway in New York City in the summer knows that. So the issue is that, that's understandable that people may be reluctant to do that. But to be quite honest, you can see fears just going anywhere. And I was doing a presentation yesterday for 11th graders in Los Angeles area. One of the kids just asked, is it safe for me to go back to school? I mean, I think all kids are going to be asking that question, and all adults. And the answer is, we can't tell you it's zero risk. So there is risk whenever you go near people. But I do want to point out that fear of leaving the home happens even when there's not an infectious disease. So after Hurricane Katrina, I was doing some work in New Orleans afterwards, and one community doubled its population in 1 week. They were very close to New Orleans, and they had a lot of displaced students, and it was a small community. And they had these students in trailer parks that were very unpleasant and not appealing at all. And they told me that when they reopened after the summer, that the majority of the students who had relocated and registered for that school had actually not attended a day of school yet. And so I said, did you do anything to go out and get them? And they just looked at me and said, we're struggling, they doubled their school population, but they didn't double their budget, staff, or buildings, and they also were right near New Orleans, so they got a lot of flood damage too. So they just said, please tell us, we don't have to try and deal with them. I mean, we're struggling with the ones who showed up. And I just, I felt bad. It's kind of like a back to school meeting of the school administrator. And I just said, you don't have to do that. I mean, but they're eventually going to show up. And when they do, they're going to be really emotionally distressed and very behind academically. And it's just going to be harder, but you can wait. And, the administrator just looked at me and said, of course we will now do something. I just was so overwhelmed. I just say, now that you brought it up, you're right, we'll go reach out to them. So I'm telling people, I'm just seeing too many people talk about what are we going to do when school reopens. And back in March, I was saying, that's 6 months later. Are you really going to let the kids struggle for 6 months? And why would any kid feel the school cares about how they feel emotionally if they haven't said anything for 6 months? So I think we really have to actively reach out to the ones who don't show up, but also reach out to the ones who do. And, tell them we care. And that's what those scripts are about. They're a way to kind of structure that initial conversation on the first day of class.
As we have over 2,000 members of our organization, which are pretty much far majority are school administrators. And as we ask them what are the biggest things they've learned and what are some of the biggest things they're prioritizing for the coming year, is that they've learned about the huge mental health needs that they see, and social emotional needs that they see. And also this idea of what you just were talking about, how they lost some kids during the spring session, virtually they just stopped engaging or what have you, and the need to reconnect. So it really is equipping people today with this. I'm curious about, for example, CASEL is an organization a lot of folks know with social emotional learning. Just the past week or two, they came out with an update. They called it a roadmap with around SEL for reopening school. I'm just curious, as you know, with your expertise in that, how do you see that fitting with what you do for people that are trying to think about, where they go for their go-to resources and working through these big issues with their people?
Sure. And I saw mention of that, but I haven't gotten through their
Sure.
guidance document yet. I do have to say CASEL is a supporting organizational member of the coalition. So that's one of the member organizations that I talked about. And to be quite honest, the people who established CASEL, both the chair of the board and the person who was the first director, who's still very much involved, they're both close collaborators from when we both were in the same we were all in the same community and university. And so my research, you mentioned that I did research in schools. It was in the social development department of the school system with these same people. So, I have a lot of respect for CASEL, and I think it's one of the leading organizations, if not the leading organization, in advancing social and emotional learning. And as I said, some of my research was related to social and emotional education in inner city school system. So I would say that those CASEL in particular will talk about some of the classroom-based approaches as well as the school climate and culture approaches to improve social and emotional learning in students. And I think that was all of this stuff, to be quite honest, like bereavement, for example, 9 out of 10 children experience the death of a close friend or family member. And when you actually ask them, about 5% of US children experience the death of a parent by 16. So, there was already racial discrimination, social injustice, impact of poverty, food insecurity. To be honest, all these things were there in schools before the pandemic. I think now it's just so glaringly obvious. So I think it's good people see it, but many of us have seen it for decades and have recognized that probably the thing that is going to limit your students' learning the most is not your teaching methodology. It's the social and emotional learning. And so one of the research projects that I did, which was a large scale randomized controlled trial of implementing social and emotional instruction in inner city school. It was, several $1 million intervention study. One of the findings we found was that kids who did the worst in terms of meeting state mastery tests related to reading, writing, and arithmetic in reaching, the basic proficiency. We found that kids who were randomized to get more social and emotional learning instruction actually did better in all 3 of those areas. So and that was, more than a decade ago. So it wasn't just my group. I mean, CASEL's already put out summaries of meta-analysis of research that has shown this. Data's always been there. I just hope now we act on it. My concern, though, to be quite frank, is that when schools reopen, they've got less money, significantly less money than they used to. And there are so many fixed costs. You can't cut custodians, you can't cut bus drivers because you need probably more buses to get kids safely to school. If you want to use physical distancing, you can't cut teachers, you can't cut your IT department, your personal protective equipment, your supplies, your ventilation system. All these expenses are going to go up or at least stay the same. And unfortunately, what my experience has been is that one of the things that people see as a not fixed cost is support professionals. And they cut them after crisis events to meet budget.
Yeah.
And I think that's going to have a devastating impact on schools and on students in particular. So I think it's always been a need. It's a glaring need now. I just don't see yet how we're allocating the resources to meet all of those needs.
And I
don't envy your members in their positions.
Thank you for this is equipping us to deal with whatever we have our best we can. So one of the things to this end, I see our friend Beth Herman Beth is just put in the chat line while you were sharing your comments, the actual link to the CASEL document. Again, reunite, renew, and thrive. That's the roadmap I mentioned. So thanks, Beth, for doing that. And Beth, if you don't know Beth Herman, she is one of our state leaders in for the Department of Public Instruction, particularly around the consulting for social emotional learning. So thank you, Beth. Thanks for helping make the connection actually with Dr. Schoenfeld for this today as well. Also, Beth Wartzenluft from the Milwaukee Metro area, she's a school administrator there, raised the question as follows. She just goes, could you talk a bit about how to support students and staff who are going through an actual grieving process through coming back to school in a drastically different way? I think the power lies, she says, in the acceptance stage, yet I'm looking for ways to help move us toward that acceptance stage. Can you comment on that?
Yeah. And so I talked some about that, about kind of the unique challenges. And as I mentioned, schools can become grief sensitive and get a lot of free training and also get a grant for $500 just by pledging and having a brief presentation. But in terms of what to do, the first thing is we just have to acknowledge that we should talk about it. And so a lot of times classroom educators tell me, well, I don't want to say anything because I'm just going to upset the kid. If I ask him about his grandparent that died, he might start crying. And I'm like, you do know the question isn't what upset them. You just invited them to share the distress they already had. They're upset about the death. They're not upset about your question. And then they tell me, well, yeah, maybe that's true, but I'm just afraid I'm going to say the wrong thing, just make it worse. So it's better to say nothing. And that's why I go over, that isn't better. But in terms of what I try and underscore for classroom educators is that we're not expecting them to do bereavement counseling. That's not their role, but they can be supportive and empathic. So, I often show this video clip. We use a lot of video on our website. I don't use it in the remote trainings because it's hard to transmit it with the bandwidth, but they're really very effective for training purposes, and our website is filled with these brief videos. So one of the clips that I really like was I asked a classroom educator about her experience in this, and she said, one day one of her students came back to class. His mother she knew that his mother was sick and in the hospital, and that's why he was out, but then he came back and told her that actually his mother had died. And she said, I was really upset about it. I gave him a hug, and I said, oh my God, I didn't even know that. I'm so sorry. What can I do? And apparently the kid just said, please don't do this. Like he was just embarrassed, and he said, don't do this. And she said, okay, well, I'm here. My door is always open. All of us are available for you whenever I can help. But he didn't come for help. But 2 weeks later, he stopped by after school, and he said, I just wanted to say thanks. And she said, thanks for what? And he said to her, well, I just want to say thank you. And so she said, okay, you're welcome. I don't even know what I did. And he just said, you were here and I didn't have to talk about it. So just acknowledging that the loss occurred was really all he wanted. And I see that not happen so much of the time, that people pretend nothing has happened. And then kids have to grieve in isolation. And so what she said to me was, it's kind of like a dance. I take the first step. If the student takes the next step, we continue the dance. If not, we can just stop and listen to the music together. And I think that's just a great metaphor, because that's what we're going to be doing, is we're going to all be listening to the music together because it affects all of us. But I think the thing is, educators feel like, I don't know what to do. And sometimes they want to pretend that they're not upset because they feel like if they start showing or share anything, they'll fall apart. And so that communicates to kids that that's what happens. Either no one else cares and they're the only one that's this impacted, or if they start to talk about it, they're going to fall apart and they can't really cope. So I don't think you really move to the acceptance stage. I think a lot of the work in bereavement that it suggested you go through these stages and eventually you have acceptance. I actually think to some degree you never accept the death of someone you love deeply. You constantly re-question why it happened and why something like that would occur and what meaning it has and what impact it has on your life. We grieve for a lifetime. The problem is we don't talk about it or acknowledge that. And so, yes, I think you come closer to acceptance. But I don't think we're going to accept that this pandemic occurred, and particularly if you lost someone you love. I think you're always going to question, what if they had stayed healthier for longer until there was a vaccine, or until we knew better treatments, or before they I mean, she was put on a ventilator, or maybe that hastened her death. If only, you're going to have all these questions. Kids are going to wonder, did I infect the person? Did I expose them unknowingly? Maybe I didn't have symptoms and I gave it to them, or I should have seen them breathing quickly and insisted that they go to the doctor. I should have called for a car to bring them. They're going to question everything they did, didn't do, could have done, or should have done. They'll feel guilty. And a lot of times, people do that because it gives them the illusion of control. Because if you think there's something you did wrong, you can promise not to do it again and then believe you can actually prevent it from happening again. But to actually accept you had nothing to do with it, that's often the hardest thing, because then that means it could happen again. So there's lots of reactions kids have, and that's what our material talks about. Guilt is just one of the most common.
And Beth just let us know, she really loved that metaphor. So did I, about this idea of it's a dance, take the first step, we'll see if you respond, then we just figure it out from there. I mean, I think for a lot, the big message in that metaphor to me is, as adults who care about our students, we serve our students and communities, we have to show up to the dance hall. We have to get our back off the wall and be willing to at least take the first step and notice and, learn some things so we can be helpful and caring. And, that sort of approach. So I appreciate that. We have time for one more. Oh, I'm sorry. Yes.
Yeah, just one comment. I mean, I will tell you that when my daughter got married, the thing I worried most about was the first dance, because I don't know the dance stuff. I don't know how to dance. I'm really bad at it. And we don't teach the dance moves in schools of education or in medical school. And so I think people don't start the dance because they don't know how, and they feel like they're going to just trip and step on someone's foot. So or it's not their responsibility or role. So I think we have to articulate that, yeah, there's a lot you can do with very little effort, but it does require sharing of yourself as a person.
Well said, very well said. We have time just for one more question and then wrap up here in time. So my last question for you is, with all your experiences and all the background that you have, curious about how you'd answer this. We used to think this about helping people deal with grief, but now we understand this. Can you help maybe clear up a real common misperception in a way that what you've learned through all your experiences about how to really help with this?
I think that we used to feel that the best way of dealing with grief, crisis, and loss was to return to routine and structure and the way we were before, and that kids thrive in structure. They thrive in consistency and predictability. They don't thrive in having the enforcement of the structure that they no longer can handle. So they want to be back in school or stay connected with students and teachers and have something predictable about their life that they can handle, but they need accommodations and adaptations so that it isn't overwhelming to them.
Yeah, that's wonderful. Thank you so much. Again, very helpful distinction. As we wrap up today, I just want to have a few closing comments. I just want to share one more piece. I'm just going to quick share my screen here. So we'll do that. So one thing is, I just want to say, Dr. Schoenfeld, thank you so much for, first off, for what you do. I mean, the litany of things that you listed early, that I read off as well early, where you've provided human compassion, support, and guidance for us working through some of the most traumatic of things in our country's history in recent decades. I mean, just, there's a lot of amazing work that you've been leading and doing. And just, I thank you on behalf of humanity and our nation and for our time here with you today. So thank you for that, sir.
Thank you.
Also, I want to say thanks again to Beth Herman. She helped make a connection with WCAS and ASA with this center. I mean, I became aware of it in recent months. I should have been aware of it longer, but I wasn't. I'll just share that. So I learned a lot about this center in the last 30 days or so. And I hope you learned a lot about what it does, how to access it. I mean, I want to remind people again, for example, and you'll see them in the chat line again, but also on this slide, the School Crisis Center, again, available to anyone here, toll free, 24/7, 365, or email. So it's just another resource to have. And you also heard about the Grieving Students one as the coalition. So again, think resources we can use and leverage and equip our leadership and our service with. And then I just want to thank all of you on the session, because of course you're doing the work with the people, with the students, with your communities, and it takes many hands and it takes really committed leadership. So it's always an honor and privilege to help learn and grow and lean into all what's needed at a given point in time. But just remind you all that, you were created and you were made for just such a time as this. Never doubt that. Lean into the learning, lean into the serving. I like the idea of lean into the dance and see where it takes you, one step at a time. And so thank you again for that, Dr. Schoenfeld. The thing I want to share before we go, because there are some, again, some state resources we're trying to develop over time. I hope you're aware of the Wisconsin School Mental Health Framework, but one way we've worked with the Department of Public Instruction, Beth Herman and friends I mentioned earlier, is we developed a couple of years ago our Mental Health and Resilience Academy, which is really designed for leaders, folks like on this session today, to get into a deeper understanding and collaborative understanding of the school mental health framework in Wisconsin, particularly around SEL, trauma-sensitive schools, and compassion resilience are three major pillars of the framework. And we try to help you understand those in ways and gather data and make out plans for something that's going to be relevantly helping you meet the most pressing mental health needs and build resilience in your staff and your students and communities. So very relevant today. Registration is still open. We'll launch again in the fall with this multi-day academy. So just know that that's a resource. I did put in the chat line again the link to this if you're interested in more information. And then again, a reminder, by Monday, we will have, we intend to have by Monday anyway, in your email inboxes, whether you're able to join us live today or through the recording, we'll have the recorded link in your email inbox, plus a PDF that of all the slides that Dr. Schoenfeld so graciously shared with us. So I'm thinking, like my years as a school leader and a district leader, I'm thinking there are pieces of information when we come back to school that I want to share with my staff, because there are, again, I want to equip people to have the dance one step at a time with whoever needs it, and to equip people to be better, compassionate servers of the human need in front of them. So I thank you for, again, sir, for sharing your expertise, your resources, the ability to get connected as people need it. So that's all for today, everyone. We thank you so much for joining us. May this session's content equip and bless your ongoing efforts to lead, learn, and live. Thanks, everyone. All the best to you. Have a great day.